Okay, Chapter 2B, Medical Tests and Risk Profile. So this one's relatively short. So the medical history, physical examination, and laboratory tests, a lot of times the facility will determine what you are going to do. The components of a medical history, again, they're gonna, if you're in a medical-based facility, they're going to have forms. If you're in a corporate wellness type of facility, they will also have forms. They should be asking these sorts of questions in some form or another. So things like a medical diagnosis, previous physical exam findings, laboratory findings, history of symptoms, recent illnesses, surgical procedures, orthopedic issues, medications, as well as supplements and over the counter drugs that people might be using, other habits that are related to the exercise program, their exercise history, their work history, their family history. There should be forms. If you go to a doctor's office, they will have forms for these things. It's a good idea to kind of look through it if you have access. There's going to be HIPAA and FERPA and all these privacy types of components that they may not let you look at these documents. But if they do, great. If you're working with somebody, if they would bring them to you, that would be good too. And if you're working in a private facility or a commercial community type setting, then in some way, shape, or form, you should be finding out this information. So, what to look for on a medical history? The history, the client's history of illness, surgery, and hospitalization. This is from the text, so this is pretty similar to what the previous slide was. And so I'll skip to the bottom. Really, one of the key issues is there anything interesting that you need to know of? Is there any red flags that you need to be aware of? Use your thinking. Kind of evaluate this person. Is there something that's there that you really need to be aware of? Something like hopefully you capture it in the medical history. Sometimes you might not. So does the person have a lot of mental stress? Are they going through a divorce, or do they have problems with their children? Do they have an autistic children or a child with special needs? This can provide a lot of extra stress for the individual. So trying to get that information and really, how is that going to affect the job that you do, knowing that they have these issues? And the issues will be similar between people, but they could also be different from one individual to another. So components of the pre-participation physical exam. When you're looking at a list like this from the ACSM textbook or from the Hayward textbook, kind of keep in mind what are the things that you might be doing. So assessing their body weight, that's something you'll definitely be doing. Determining body mass index, determining percent body fat, that's something that you were more likely to do than somebody in a physician setting. Apical pulse and rhythm, you're probably not going to do that. Arresting blood pressure, you may do that, and you might do that through an automated cuff. A lot of times that's done. Listening to breath sounds, you probably won't do that. Palpation of cardiac apical pulse and point of maximal impulse, you're not going to do that. Listening for heart sounds, you're probably not going to do that. So really, you want to keep in mind what are the things you are going to do. So one thing that's not listed on here is an exercise test. You should and probably will do an exercise test. Again, that's part of the medical the medical profile of the individual. So evaluation of abdomen and bowel sound, you're not going to do that. A lot of these things, looking for edema. So edema is swelling, xanthema, and the other thing, I don't know how to spell it. I don't know how to spell it. I don't know how to pronounce it. I looked it up online, and a lot of times when you see these types of terms, you should Google them to see what the heck are they talking about. These are the skin one is a discoloration of the skin. The tendon one is kind of like a growth type of thing. I don't know what's the implications of that, but whatever it is, if you see a term like that, or if somebody comes to you and says, "Oh, I have this and this ailment that I'm dealing with," and you have no clue what the heck they're talking about, then look it up. Or ask somebody that can answer the question. You may also ask the individual, what is that? So they may have a pretty good feel for what it is as well. Follow-up exams, especially related to orthopedic or any other medical condition, especially if they affect an exercise test or the ability to exercise. Tests of neurological function, reflexes, cognition. Definitely, I mean, cognition and things like that are important throughout the spectrum of life. You'll see some people get it, some people just don't. And especially as you deal with children and as you deal with older adults, you'll see that kind of more and more exaggerated, the extremes that can go to. Looking at the skin now, generally you're not really going to do that, but with the case of a patient with diabetes, they might have a wound that's not healing properly. So for you to kind of keep track of that is good. One of the things that's important here, just in general with the physical exam, is that a physician will see a patient once every couple months, typically, unless something's going wrong. But you may see the patient or the individual, the client, on a regular basis. So if you're dealing with a diabetic individual and you see that they have a wound and the wound pretty much seems to be getting worse or isn't healing properly, then you're seeing that on a regular basis. And then you can kind of take the appropriate action to say, okay, I really recommend that you see a physician, get this taken care of. How are you taking care of it? Things like that. So you can do the follow-up that the physician or other individuals in the medical community are not doing, not because they're not doing a good job, but just because the patient's not going to those individuals. Because they see you on a regular basis, either a couple times a week or even just once a week, you have that feel for, okay, has this changed over time? Is it getting better? Is it getting worse? What's going on? And then you're kind of the help the person from falling through the cracks so that then they could get the appropriate care. So within all of this, if you see something that just doesn't look right, oftentimes a client or individual will come in and they've got a shoulder issue and they're having new pain, or they might have done something while they were over the weekend, and they may have pain associated with it. And then you're that individual that can say, you really need to see a physician or the appropriate medical professional to get that taken care of. So that's an important role of yours, that as you have this list, great, but as you see something, and if you see something out of the norm, you should do your best to try to refer that individual to the appropriate professional that can then take care of things. So the recommended lab testing, the laboratory tests, when they go to the physician will probably do some sort of general blood chemistry testing, and all these things will be covered in the blood chemistry testing. You're not going to specifically administer this in most instances. If you see the individual's blood chemistry profile, it is a good idea to look at it, especially as it relates to you. What's their cholesterol level? What's their blood glucose level? Is there anything that you should really be aware of? What's their blood pressure? Things like that. One thing that's very important is medication use. Are they taking their medications on a regular basis? And by talking to them and seeing their progress, especially with blood pressure, high blood pressure, it's important to check their blood pressure on a regular basis, especially if the person has already a history of documented high blood pressure. So, looking at laboratory tests is important. You're not the end-all be-all. The physician or the nurse practitioner, the physician's assistant, they're going to be the ones responsible for these values. But if you see something that's odd, for you to ask questions and try to address it, I think that's a good idea. Now, you're not going to solve the problem. All you're going to do is then refer the individual back to their healthcare provider to say, okay, I see that they have a high fasting glucose. Nothing's, it's above 100, but below 125. Okay, it's just elevated. We'll keep monitoring it. If it's 130 and they're not doing anything about it, then the cut point is 126. Something should be done, or what's the medical plan for it? So to kind of keep those things in mind, that and if you see just a number that's odd, what are they doing about it? What's being done to take care of it? So you're more of a you try to keep people from falling through the cracks, but this is not your primary responsibility. But with that said, if you want to be giving individuals good service and improving individuals' health, to kind of take a look at these things, and if you see something that's really odd, to then try to address it, it's a good idea. Individuals with signs or symptoms of known cardiovascular disease. These are different things that they will do from them. If you work in a cardiac rehab, you will need to know the cardiac aspect thoroughly. If you're not working in a cardiac rehab, you won't really have the ability to do these things. But one thing with any medical condition that you should be able to do is, if you're able to read their medical chart, to make some sense of what's going on in that medical chart. And as I mentioned previously, if you don't understand something that's in their medical chart, to ask someone or try to find out what's going on. Same thing with the pulmonary diseases. You're not really going to be doing anything there, but to try to figure things out. The pulmonary issues, a lot of times those people are very sick. They're going to be more in a cardiac rehab, pulmonary rehab type facility. They're not going to be at the general community or corporate wellness types of facilities. Individuals with heart issues, they may end up showing up at your general community, private and corporate types of facilities. So this is a list of the risk factors. You need to memorize this. Realize that for each risk factor is a category. Sometimes that's obvious. For age, it's kind of obvious. But for family history, you may have a mother who had a cardiac event or some sort of documented cardiac issue, and the mother had the issue at the age of 60. Your dad had the issue at the age of 50. That counts as one risk factor, not two. So kind of keep that in mind. Do you meet the criteria for that category? You'll see that the same as we go down real quick to dyslipidemia, that people might have multiple values that are not correct. If that's the case, then all of that counts into one category. So family history, a father or first degree relative, so it could also be a brother. It could technically be a child, but that's usually not relevant in these cases. It could be your mother or sister, but cousins, aunts, uncles, and grandparents, they do not count into the family history. You might want to keep it in mind, what's going on with these types of relatives. But as far as a risk factor criteria, it doesn't count unless it's mother, father, brother, or sister, or technically child as well. Cigarette smoking, they don't really assess how much you've been smoking, just whether or not you've had exposure in the past 6 months. So if you quit a year ago, then you do not have the risk factor anymore. They don't assess whether it's a half a pack a day or whether it's 3 packs a day, though I don't know who could afford 3 packs a day anymore. But regardless, the criteria is, have you quit 6 months ago or not? They don't take into consideration other types of smoking, marijuana smoking. They don't really address vaping here, but I would consider that anybody that has those other types of uses of cigarette or tobacco or marijuana, that they would also count into that category. Physical inactivity, so people not completing 30 minutes of moderate activity on 3 days, at least 3 days a week, also fall into that category. So you might not be completely meeting the recommendations even with that, but are they completely inactive? Obesity, Uh, I hate this characterization or the way they do this, but it's whether you have a body mass index over 30. In the past, uh, they don't list it here. In previous ones they did, but they do assess whether or not you're physically active or whether that body composition is appropriate. So if you have an individual who you suspect their body composition is fine, they're just muscular, and you'll see that with some of the men, uh, then you could do a body composition measure and kind of use that to say, okay, this individual doesn't really have the obesity risk factor. But it's over a 30 body mass index of 30, or a waist circumference of 102, or 40 inches for a man, 35 inches for a woman. That's not that hard to reach. Most people that have those values, especially if it's hovering right around that value, they do not consider themselves obese. They consider themselves overweight, but technically, according to this, they are obese. And it's one of the interesting things where usually uh, the accurate term is preferred over some sort of pop culture term. But the reality is somebody would rather be called fat uh, than obese. People do not like to be called obese, but to meet the obesity criteria, a lot of people are falling into that criteria that don't think of themselves or don't characterize themselves as obese. Hypertension, either value. So if your systolic is 142, you have hypertension. If your diastolic is 92, you have hypertension. So if you have a blood pressure of 142 over 86, you have hypertension. If your blood pressure is 136 over 92, you have hypertension. So whichever number is higher, that's what meets the criteria. Also, if you're on any antihypertensive medication, so if you're on meds for blood pressure, you automatically have the risk factor. So the individual's blood pressure might be controlled, great, but they do have the risk factor as far as this is concerned. Dyslipidemia, any of those values, usually they go together, but you will see people with relatively normal total and LDL cholesterols that have very low HDL cholesterols. That's the good cholesterol. And if that is the case, then those individuals uh, are considered to meet the risk factor. So you will see individuals with HDLs of 20, 25, especially men. Their total cholesterol might be normal, but because their HDLs are so low, they are considered to have the risk factor. Diabetes, which is a fasting blood glucose over 126, if they're fasting an overnight fast, or if they've done an oral glucose tolerance test of over 200, so they drink a syrupy drink, and then they measure the blood glucose at regular increments. If the blood glucose is over 200, they're not metabolizing glucose appropriately, in which case they are considered to be diabetic as well. We'll talk about diabetes a lot more in the future, but diabetes is a major risk factor for heart disease. Now, one where you take a risk factor away is if your HDL cholesterol is over 60. So if it's over 60, you take one risk factor away. And here are the breakdowns if you specifically talk about cholesterol and triglycerides. So it gives you the categories and the number value associated with it. These will be on the test, so make sure that you memorize the values. And generally, we like to have low values, low LDL cholesterol, low total cholesterol, low triglycerides, but for HDL, the higher the value, the better. So we want HDL cholesterol values to be good. Now keep in mind, just because your cholesterol levels are bad doesn't mean you're guaranteed to have heart disease. Conversely, just because your cholesterol levels are good doesn't mean that you're guaranteed not to have heart disease. So there's many factors. There's genetic factors that are involved. generally, if your cholesterol is high, you're at increased risk for heart disease. But it's not always guaranteed to be true. So just kind of keep that in mind, that these values are important. They guide you, but they're not necessarily an end all be all. That's it.